With this year's healthcare open enrollment period coming to an end in just a matter of days, it's crucial to make your elections to ensure the absolute best in coverage for 2024. Yet, many are still on the fence and have questions in regards how to make those elections. Gabriel Braca, health insurance expert with Vitalsurance, stopped by with some tips to help along the process. Gabriel, welcome back. Great to see you.
Thank you for having me again.
Open enrollment is still happening. People are still looking to make the right choice when it comes to their healthcare and their healthcare coverage. What would you say to those who are self-employed or don't have employer-sponsored healthcare? How can they benefit from this time?
It's very simple. First of all, there are only a few days for them to enroll. But self-employed have two options. They can get a private insurance through Florida Blue, or they can do a group health. A group health is an insurance that they will include also their employees. And there are a lot of benefits for that.
The nuances of selecting a health provider are many, because you want to, obviously make sure that you can afford the coverage if you are self-employed, deductibles, in-network, out-of-network. We talked last time you were here about prescription drug coverage, which is massive. It's a huge element of healthcare. Are there any pitfalls that we should look out for when it comes to selecting a provider?
Usually you have to make sure that you select the right network. So the network is linked to the provider. So usually we work with our clients and make sure that the doctor, because there's some people that are going through treatments, we make sure that they are with the right network. Florida Blue, for example, has a lot of networks. So we have to make sure that it's working for that client.
How does Vitalsurance make the client and the patient feel comfortable? Because as you know, we're talking about costs. Inflation is up. Our health is wealth. That is the most important thing that we can protect, because it services so many things. And when we come to a broker or an agency that helps us select a healthcare provider, we want to feel comfortable that we're making that right choice, that we're being led in the right direction.
The first thing, we lead you to the right plan, and after that we educate you constantly. So when you have a question, we ask you to call us every day if it's possible, because insurance is complex and we understand that. For us, it's not complicated.
You're the experts.
So we urge all those people that purchase those insurance from us to call us all the time, because that's the only way you feel comfortable.
At the core of all this, as I said, Gabriel, and thank you for sharing something that's important. I'm sure our viewers receive that well. The core of all this, of course, is cost. Everyone's cutting costs, right? And we want to get more with less, rightfully so. We work hard for the money we earn. We should be able to use it and have it work for us as well.
Yes.
How can we cut costs when it comes to health insurance?
Well, one of the options is, obviously, as you know, there are subsidies through the government. So the subsidies can be substantial. I've seen people even with the area of income of $200,000 and $300,000 with a family, and they still get really nice subsidies.
Yeah.
So they have to talk to us about that, and we can help them.
So thank you for helping us with that, and thank you for speaking.
Thank you for having me.
On ISF.
Thank you.
All the best.